Hi everybody, this is Dr. Kammerer. Today I'm going to talk a little bit about ADHD or ADD. I have a ton of stuff I'd like to talk about, but I'm going to try to keep it kind of condensed, and then I'd be happy to answer any questions if I don't cover a topic that that I talked about in the video. Let's wait a few minutes and or not a few minutes, but just a second, see if anybody else joins in. I want to ask you to share this video in case maybe you have some friends or family that might be interested in this information, and maybe they haven't even talked to you about their concerns for their child having ADD, but it might be useful for them, or maybe they have a friend they've had some concerns about. Maybe they're a teacher, or they would just want more information about ADHD and ADD. So go ahead and share this video. And let me get started talking. So ADD and ADHD are the same thing. People just use the terms interchangeably, but they're the same medical or the same diagnosis. ADHD stands for Attention Deficit Hyperactivity Disorder, and ADD stands for Attention Deficit Disorder. And they're treated and managed the same. But different doctors or different people will use them interchangeably. So that's kind of what I'm going to talk about today. I want to say that, I have my little notes here. So each time I see a child or talk with a parent about ADHD, it's a different conversation. Every kiddo is different. Every parent is coming from a different place. Maybe this is their second or third child with ADD. That conversation is going to be completely different than a parent who has heard terrible things about ADHD their whole life and is really uncomfortable talking about it. We're going to approach it very differently. Either way, we got to have a good diagnosis, which is based on what's actually happening, and have the parents be comfortable with what we're doing. So this is definitely not something that I'm ever just going to throw medication at. We're going to talk quite a bit and do evaluation before anything gets started. So what does that mean? Or what is ADHD, where it might be different than what people who, they might have an idea about it. It's a neurological disorder. It affects attention. You're going to see kiddos who are up and about all the time, fidgeting, but you also see kids who are just staring off. They're actually really well behaved because they are in their own little world most of the time. And how that's going to show up is at some point they're not going to be able to follow along closely enough at school that they're going to understand what's going on. Or maybe other activities too, they're in a dance class or baseball when they're little, everybody's kind of running around, and at some point some of the kids are able to follow along, listen to coach better, and the other kids are daydreaming and they're just not keeping up even though they love it. They want to keep going. They're not doing anything wrong. They just have trouble capturing that information because they're thinking about something else. And it's definitely not because they're a bad kid. That's the way their brain is wired. So what we need to do is get to the root of the problem. Is there other things going on too? And figure out if we can help them to be successful with what they're interested in and show us what they really know, and be happy with school and their activities and stuff, not be getting in trouble all the time. That's my number one goal, is to have kids really enjoy what they're doing and not be getting in trouble for something that they can't control. So the benefits of a diagnosis, big one is, the reason I say this is because parents don't want their child to be labeled, but what that does is it gets you supports at school. That's the biggest thing. You can get something called an IEP, Individualized Education Plan, or accommodations, and that gives your kiddo extra time for tests, quieter area, especially for these standardized tests. It's really important. And a lot of teachers are already doing this informally. Really good teachers know what their students need and they want them to succeed. The thing is, if you're going on to the next grade, that teacher might not do the same thing, something like that. So it is important to have that diagnosis and have your accommodations in place. And I want to talk about first signs. So how would we even start this? A lot of times the teacher will bring something up, and it's important to keep in mind that the teachers cannot say, you need an ADHD diagnosis. I've definitely heard of patients say their teachers say this. That's fine, they're trying to be open and honest, but a lot of times it's more roundabout and the parents don't really know what the teacher needs because the teacher doesn't feel comfortable or they've been told not to say that directly. And that's fine. We can tease out the information during our visit, no problem. Parents don't need to come to me telling me the diagnosis. That's what I'm here for, is you tell me what's going on and we figure out what it is. Were their kiddos hyperactive? They're having learning issues, and then sometimes a family history is really important too, and it can actually go both ways. I'll have kids their mom or grandma has said dad had the same issues or mom had the same issues, or we'll get a diagnosis for the kiddo, and in the process of the evaluation, a parent will say, "This is how I was in elementary school. I never got help. I got in so much trouble. I could have really done something different if I'd had treatment." So it can go either way. Like we either know ahead of time and we have some insight, or later it all just kind of comes together and we kind of understand better what's going on. So initial evaluation, what does that look like? There's a couple different options, and it's best to do at least one formal evaluation. That can be through me. I'm happy to do a pretty thorough discussion, a objective test called the Vanderbilt, excuse me, that usually involves a parent filling out a questionnaire and a teacher, and of course that's going to be more difficult now, but it's probably still possible to get a hold of a teacher or a coach, somebody else who's been working with the child and could give us some information. I'm not going to withhold a diagnosis just because schools are closed, but we're going to at least do our due diligence to figure out what really is going on. And then there might be some indications to do some school or educational testing before we ever make a diagnosis of ADHD. That would be things like dyslexia testing, learning issues, reading, math, and the school takes care of that part. I don't do that. That's an education-based testing, something to talk to the school counselor and the teachers about. Even if they don't bring it up, parents are free to discuss this with teachers or look up information. Look up Google. I think my child has an education disability. You can look at your school district to get recommendations where to start with that evaluation. I'll help you, guide you, no, definitely, but I just don't do that evaluation. And then other medical stuff, of course, what's the child's prenatal history? Maybe they're adopted, we don't know all the history. Or how's their growth been their whole life? When did symptoms start? And was there anything else going on at home? A lot of kids have anxiety and depression. They either have both anxiety and ADHD. Their ADHD is causing anxiety, or they just have anxiety and it looks like ADHD. So these are very key things to kind of tease out. Sometimes at the beginning the symptoms are so severe that I don't feel comfortable doing this evaluation, and I'll say I'll find you a psychiatrist or another specialist to help us, or I'll say I feel comfortable treating your child. We're going to start with the treatment plan, which I'm going to go over in a minute, which, like I said, is not just throwing medication at the problem. We're going to start that, and if I see this and this, or it's not working, then we're going to have to get more of a team going. I can't do it by myself. So those are just some things to kind of think about. Definitely a physical exam. Most of this exam, really, I feel comfortable doing via telemedicine. So that's why I'm talking to you about this. I'm not going to talk to you about something I can't actually help you with. So that's going to involve a skin exam, neurological exam, strength, balance, a bunch of different things that I have done by telemedicine before. And definitely if a kiddo has an up-to-date physical, I would love to see that, because that just gives us even more reassurance that we're healthy and we're in a good spot to get this going. Sometimes kids need a little further eval with labs or heart testing or something. We kind of go through history of risk factors that would make that something we need to do, and that can be done by telemedicine as well. I can send those orders locally to where the patient is. Let's see. So like I said, I have a lot of information. I'm going to finish up here in a minute, so I'm just going to kind of give an overview. I know I'm talking a little too fast. And if you like what you've heard so far, please go ahead and share this with friends so that they can see this information too. So the last thing is treatment. And there's a lot of different ways to say treatment, but think of 3 different things. And this helps keep it simpler. We got education, behavioral, and medication. So education is when we take this diagnosis to the school and we work with them to make an IEP, behavior plan. When I see patients in follow-up, I ask them, did you tell the teacher? Have you had a meeting with the special education department? What's happening? If the parent tells me nothing, I'm going to write a letter for you to take. If they say it's going great, I'm going to say that is so wonderful. And the best is when we talk about school and kids say, I got on a roll this semester. I got best kid in class this semester. You know, they have all these awards even down to kindergarten now, and those are so great for kids. They just love school when they get recognized like that for finding out what the issue is, and then they can do what they need to do. So anyway, I got off. So that's education. Behavior, sometimes kids need counseling, not always. Sometimes modifications at home can help. I have some resources I really like. One of them is Attitude Mag. I don't like every single thing on the website, but they have some good resources. ADDITUDEMAG.org. And the third is medication or medical management. Medical to me includes lifestyle stuff. Sleeping, we got to talk about sleep. We got to talk about, thank you, Katie. We got to talk about sleep, diet, you know, are they getting nutrition, protein, fruits and veggies every day, or are we on a diet of junk food that kids' brains cannot run on? And I don't do a ton of supplements, but I'm happy to answer questions about them. And then also exercise. If a kid's stuck inside all day watching TV because their parents are having to work, or they're with a sitter or a grandparent who really can't get up and do a lot of stuff, we're going to have to brainstorm some ways to get over that hump because they need to exercise and get the energy out or they cannot focus. So I count that as part of the medical piece, and definitely one of the first steps before we move on to medication. That being said, I'm not scared of medication. I really wish more people were not afraid of it. But if they are hesitant, we do other things first. We always do other things first, and then we move on if it's needed. Start very low. Start with medications I've prescribed a lot of times to young kids. I'll start usually 5 or 6, but we can do, like I said, there's other stuff to do first, and so maybe 8 or 9 I would say is most common, where parents are like, we've done a lot of stuff. I think we want to try medicine. We talk about the goals of therapy with attention, talk about side effects, talk about any kind of risk factors that might make it a bad idea, or if we need to do some further evaluation first. So, and then very close follow-up. Usually I will see kids back in a week to see how things are going. Often they've noticed no change because we started so low that you can't even tell. So we'll go up a little and then go from there. Follow up at least once a month at the beginning. The state of Texas requires a prescription to only be 30 days, so I will be in touch at least every 30 days, and a face-to-face telemedicine visit every 90 at the minimum. Yeah, sleep for sure. Right now we're not on a schedule, so you could stay up as late as you want, but then the next day you're paying for it big time. So I'm really glad to hear that Josh with his that's my son's name too. That Josh with what he's doing to keep his players healthy is doing that great. That's great. So please send me any questions you have. I'm going to kind of chop this into pieces so it's a little more manageable. And please share, like I said, I'm Dr. Kammerer. Let me know if you need anything. If you would like an appointment with me, you can go to rowdocs.com, ROWEDOCS.com. Thank you so much.